So feet are kind of a passion of mine, not in a weird way. Okay, maybe a little bit of a weird way. And so, my title, How Often Do You Brush Your Teeth? Okay, we're going to get to that, but you have to listen to me first. So, right now, I want everybody to take a minute, close your eyes, and just listen to me. Okay? All eyes closed. This means you. All right? And I want you to just concentrate on your feet. How do they feel right now? They hurt? They itch? Wiggle your toes. Do they feel crowded? Do you have any blisters or calluses that are bothering you? Do they feel numb or tingly? Okay, open your eyes. How often do you do that? How often do you think about your feet? I'll tell you how often, when there's something wrong, right? It's the only time we think about our feet is when something is wrong. And that's the problem. Balance. This is all about fall prevention, right? And it's going to seem like I get off track a couple times, but I promise it all comes back to fall prevention and keeping your feet attached to the rest of your body for the rest of your life. Movement is critical, all right? But a lot of times movement is painful. Or we get out of the habit and then it's hard to get back into the habit, right? But the truth is, as I'm standing before you right now and I'm just leaning a little bit, my body is constantly rebalancing, all right? Pretty much with every breath we take when we're standing, we're rebalancing. Our body is figuring out how to keep us upright instead of flat on our face. When our feet are numb or tingly or in pain, when our shoes don't fit right or we're just flat out wearing the wrong shoes, we don't balance as well. And when we don't balance as well, what is likely to happen? You fall down and go boom. Low blood pressure. What in the world does low blood pressure have to do with your feet? Well, low blood pressure has to do with falling and with your feet. If your blood pressure is low, you're not getting good circulation to all parts of your body, okay? If you're not getting good circulation, that means that you're not getting oxygen to all parts of your body, you're not getting nutrients to all of the cells, and you're not picking up the toxins from the cells to dispose of them. So your feet are really at risk when you have low blood pressure. But more than that even is falling. And when you fall down from low blood pressure, it tends to be a bad fall, okay? Have you ever heard of the umbrella reflex? Anybody ever heard of it? Okay, so the umbrella reflex is that when we go to fall, what's the first thing we do? We try to stop ourselves from falling, right? Well, when you fall from low blood pressure, your umbrella reflex is dead in the water. It doesn't work. And so those falls tend to be really nasty ones. We often see broken jaws, broken cheekbones, that sort of thing. So low blood pressure really has a lot to do with it. Neuropathy. Simply put, neuropathy is numb feet, tingly feet. The problem with neuropathy, and it is associated not just with diabetes, but with circulatory problems and high blood pressure as well, is that as your feet begin to go numb, you don't notice it. And it's such a long, slow, gradual process that you really aren't even aware that your feet have become numb. Well, if your feet are numb, how do you balance? Right? You lose a lot of that ability and it becomes a problem. Bunions, okay? Bunions are typically painful. They make you walk differently. Your bones are not situated correctly. And they change the type of shoe that you can wear, but a lot of times you keep trying to wear the same shoes you always have. All right, so we're going to talk more about bunions. Plantar fasciitis. If you've ever had it, you know that this is just an excruciatingly painful condition. You can have pain in on the ball of your foot here. It can go all the way through the arch, and it can make the heel just hurt so bad. It's like stepping on a frying pan. The thing is, plantar fasciitis is so easily dealt with. No surgery or anything. Simple stretches and wearing the right shoes. Plantar warts. We'll talk more about those. Plantar warts, they can be very painful. Again, easily taken care of, but people don't do anything about them. Corns, Sometimes corns don't bother you at all. Sometimes corns are a real problem and they can interfere with your shoes fitting correctly. Calluses. Calluses are a really, really bad thing. We're going to talk more about calluses, but I hate them with all of my heart. Improperly fitting shoes. This is only the first time you're going to hear it. You're going to hear it about 82 more times. So by the end of this session, I hope that you're asking, I wonder if my shoes fit improperly. Untrimmed toenails. All right? When your toenails get thick, they bump up against the top of your shoe, and it hurts. So you learn to walk a little bit differently so that that doesn't happen. All right? When you walk differently, you balance differently, and you're more prone to a fall. There is something called a spatial awareness that we know at all times where all parts of our body are, right? And if we know that and we can feel them on an unconscious level, we're able to respond. We're able to respond in a change in the pavement, a change in elevation when we lift up our foot to step onto the curb, right? When we don't have that, because our feet are numb, because we have poor eyesight, for a variety of healthcare reasons, we again are more prone to falls. And so learning how to balance in the absence of some of our normal responses in our body is where classes like the SAIL classes here at the center come into. I recommend the SAIL classes constantly, all day long at my foot care clinics, and I recommend them to my patients in my day job as well. I really cannot recommend SAIL classes enough. They are nationally known to make a huge difference in the quality of lives in seniors. Okay, so low blood pressure and neuropathy. It is likely that many people in this room are taking blood pressure medication, okay? So I have one question for you about your blood pressure medication. Is it working? You take your blood pressure every single day and write it down at approximately the same time of day. If you go to the doctor once a month or once a year and you check your blood pressure, that is not an indicator of whether your blood pressure medication is working or not. The majority of my patients, when they come to see me, and I don't think it's because I'm a scary person, but maybe, their blood pressure is jacked up, okay? Had a patient in the office yesterday, and I know she is so faithful about taking her meds. And her blood pressure was 157/89. And she says, I swear I'm taking everything, I'm doing everything. She was really upset about it. And I said, you know, it's fine. Go home when you're settled, take your blood pressure again, shoot me a message and let me know what it was. And she did, and it was like 123/70, right? So if I had taken that first number as an indicator of her actual blood pressure, I might be tempted to increase her blood pressure medication, right? But I'm able to look at her blood pressures every single day because I have a list of them every single day that I get electronically. And I know that's not her blood pressure. So I don't care that it's high at that moment. It's not a true reading. Neuropathy, you don't know if you've got it unless somebody tells you.
Yes. Is there a certain time of the day that you should take it?
Just about the same time every day. I will tell you, blood pressures tend to be really high first thing in the morning. Apparently, it's very stressful for humans to wake up. It can be the highest it gets during the day. Yeah, saber-toothed tigers, mammoths, I don't know. Taking your blood pressure at a time when you're a little bit chill, all right? Not, you just rushed home, you gotta make dinner, and you sit down and take your blood pressure. Bad time, okay? But when you're relaxed. When you take your blood pressure, I want you to sit in a hard chair. Don't do it sitting on the edge of your bed. Don't do it on the sofa. Don't do it in your recliner. There will be differences. So sit in a hard chair. Put your cuff on. When you put your cuff on, get it all the way up into your pit, hold it there, and then tighten the cuff, all right? If it's not all the way in your pit, you're not getting an accurate reading because the artery that we have to catch is right here, okay? So you need that all the way up there. Ideally, there's 2 fingers difference between the bottom of the cuff and your elbow when you bend your arm, okay? And the tube should come down the middle of your arm, okay? I want you to sit in that chair, put your cuff on, and chill for a minute. I want your feet flat on the ground and your back straight. I want you to close your eyes and breathe nice and deep and slow. Drop your shoulders away from your ears. Peek and push the button and close your eyes. Keep breathing. Don't look while it's reading, okay? When it's done, write it down and immediately, unless it's low, stand up and do the same thing. Drop your shoulders, breathe a couple times, peek, push the button, close your eyes, okay? You want a sitting and a standing, and it has to be in that order. Can't be the reverse order. And the reason for that is that sitting is kind of like your baseline blood pressure. We want to know what happens when you change elevations. How does your heart work with getting that blood up there, okay? So for those who don't know, you have a top number and a bottom number, right? Top number is systolic, bottom number is diastolic. Here's how you remember them. This is how they taught us to do it back in nursing school. The top number is called systolic. Think of stress. It is when your heart is its most stressed. It's in the middle of a contraction. That's as hard as it works, okay? The bottom number, diastolic, think of it as death. That's when it's completely relaxed. It's that split second between beats, okay? So we're looking at it doing its worst and doing nothing, all right? So which number is more important? Top, bottom? I hear both all the time, and the answer is both, okay? If I run up a flight of stairs, both my numbers are going to be up for a few minutes, right? If my top number is up all of the time, I'm always working at this high level, right? My heart is kind of never getting a break. But if that bottom number is up all the time, it's high even when my heart is supposed to be relaxed, right? So the goal is to get those numbers down. What is a good blood pressure? I can almost promise you that for all of you, a great blood pressure is 130/80 and below. It is rare that anything higher. I cannot tell you how many times I take someone's blood pressure and it's 150/90. Oh, that's normal for me. Are you human? If you're human, that's not normal. That's high, okay? With every beat of your heart, you are putting a great deal of stress on your heart, on every vein and artery on your body, on every organ in your body, and you are doing damage. No lie, with every beat of your heart, you're doing damage. High blood pressure is a terrible, terrible thing. That's why it's called the silent killer. It really does, okay? All right.
What's considered too low?
Well, that's a double-edged sword, because typically, if someone tells me their blood pressure, the systolic, the top number is running under 100, and the bottom number is running under 50, I'm concerned. And so then my first question is, do you feel dizzy? Do you feel weak? Are you thirsty? Do you get dizzy when you stand up? Okay, and what's your pulse? So if someone tells me their blood pressure is 98/48, okay, and their pulse is 110, which by the way is a normal pulse, okay? It's not one we love, but it's normal. I know immediately they're dehydrated and they need to eat a little something salty, not an entire bag of Lay's chips, okay? Like a couple of Ritz crackers, kind of little, and drink 8 ounces of water. Lay down, elevate the feet for 20 minutes, retake the blood pressure. If it's not better, repeat.
Doesn't blood pressure change with age?
No, that is a fallacy. Okay, yes it can, but because of damage, okay, but it shouldn't. They used to say, back in the day, they used to say, I think it was for every 2 decades of life, it was going to go up 10 points. So we accepted high blood pressure, and cardiac disease became an absolute epidemic in the country. So it shouldn't. Okay, bunions. Isn't this fun? I see feet that look like this every single day, all of it. Okay, so this is a mild bunion, okay? And mild may mean that it doesn't hurt much and it doesn't greatly interfere with the shoes that you buy, all right? For women in this age group, what do you think is the most common reason people have bunions? Stilettos. Okay, because they forced your feet into that. We may as well just have bound them like the Chinese, right? Okay, so it's a progression and it doesn't have to get worse, but it often does. Okay, so when people tell me I'm thinking about having surgery on my bunions, do we have any surgeons in the room? No, good. Okay. I always say, don't even think about it. Okay? It is an unbelievably painful surgery to recover from. It's horrible. Okay? Bunions are a bone issue. Okay? So your toes got scrunched in those shoes, all right? And they got forced over, your big toe got forced towards the center, and those two bones separated. And that bone bulges out, and that's your bunion. Okay? You can also get a cute little thing called a bunionette. Doesn't that sound fun? All right? And that's on your baby toe. Okay? Because it's getting forced into the middle as well. Okay? So can we fix bunions? Yeah, if you want to have surgery, and within 1 year, 25% return.
Something that a friend of mine got, it's like braces on your teeth.
Yeah, there are braces and splints. I don't personally have bunions, so I haven't dealt with it myself. I have had people tell me that those things are often very painful. I've also had other people say, you know, I wear it until it hurts, and then I take it off, and yeah, it's taken a long time, but I do think it's a little better. So, you know, there's no reason not to try it, right? Yes?
I'm looking at the picture in the right-hand corner.
Mm-hmm.
And my big toe is starting to do that. So those little clear plastic things that you can put between your toes?
No, that doesn't address the bunion. But at this point, if it's just starting, what you need are the right shoes and the right insoles in your shoes. So if that's just starting, I promise you, you have the wrong shoes. Okay? Okay, plantar fasciitis. So having had plantar fasciitis, I can tell you that's exactly what it feels like. Somebody lit a fire in there. It's just horrible. And it often will begin just behind the toes. That's often the first place people hear it, but it rapidly involves the heel, okay? So that just thinking about taking a step hurts, all right? And the fix is non-surgical. Okay, yes?
Plantar fasciitis on the top.
No, plantar is the bottom of your foot, and fascia is the tissue that runs down along in there, all right? But you can have other issues that go on the top of the foot, yeah. So plantar fasciitis, when I know that my feet are starting to be a little bit tender, here's one of the exercises. I'm working on my plantar fasciitis right now, okay? This is not hard, okay? So there's 3 exercises I do, and it fixes it. Doesn't just make it better, it goes away. All right? And I just spent a month walking on cobblestones in Italy, and let me tell you, my feet were not happy campers, so I have been doing my exercises every day since I got back.
You standing on your toes?
Standing on my toes and holding it for a minute, coming back down. Also do one where my hands are braced against the wall and I'm stretching one out, so I'm stretching the Achilles tendon. And then I do that toe thing on a stair so that my heels drop below the stair. Yeah.
Tip, and under your toes, right? But it doesn't go to your, what is that?
Well, it could be plantar fasciitis, it could be something else, and very often that something else is that you're wearing shoes that either your toes have to grip them to hold them, like flip-flops, which not one human being in this room should ever wear flip-flops again, okay? Or your feet are sliding forward and you're gripping your toes without even knowing it, because your feet keep sliding forward. Okay, plantar warts. You typically don't know what they look like because most of us can't see the bottoms of our feet well anymore. Okay? But if you take a mirror or something, you might think it's a callus. It kind of looks like a callus, except it hurts, and it hurts like you stepped on a rock. Okay? Great news. Come see me. I'll get rid of the thing. Go see your doctor. Your doctor will get rid of the thing. These are easily dealt with. Don't just live with it, okay? That's just silly.
But how do you get rid of it?
So I dig it out. I take my trusty tools and I get rid of it, okay? The doctor typically won't take that much time, so they'll freeze it off or burn it off. Yeah, it's not difficult, all right? Plantar warts are warts. They're a virus, the human papillomavirus or HPV. They can spread. You'd be hard-pressed to spread them to another person, but they can spread on your feet. So you do want to get rid of them, okay? Corns and calluses, okay? Corns can be relatively benign. I hear more from people that corns bug them because they don't look nice than I do that they really hurt. But they can hurt, especially if they're on the bottoms of your feet. And then calluses. Why do I hate calluses so much? Okay, there's pretty much one reason you get a callus. Anyone know what it is? Take a guess.
Sporting fit. Shoes don't fit.
Shoes don't fit. That's it. Winner, winner, chicken dinner. Okay? If you have a callus, your shoes don't fit. I don't know what else to say. Okay? If you have diabetes and you have a callus, you have a big problem. Okay? Because we don't know what is hiding under that callus. All right? So I recently had a patient here that had a callus on one of her toes. And I took the callus off. And this is a person who takes care of her body, takes care of her feet. And I removed that callus, and under the callus, there was a hole. A hole. I don't know how far that hole went. Okay? But it's not normal to have a deep hole that I can't get to the bottom of with a Q-tip. All right? This is not good. All right? This person didn't have diabetic feet, thank goodness, because if she did, she probably would have lost the foot. How would she have known about that hole without having the callus removed? Okay? Calluses are never good. They deaden the sensation in your feet. They change the way your shoes fit. They thicken your feet so that your shoes feel tight on the top. And then you're constantly rebalancing without even knowing it. And what happens when we have to do that? We fall and go boom. Never a good thing. Okay? So you need to wear well-fitted, in almost all cases, athletic type shoes. Okay? That's it, athletic type shoes. Stretchy ones that feel like slippers are not good. Okay? All right.
What about the slip-ons? Is there a difference with those?
If they're stretchy, they're not good. I will tell you, I bought a pair of shoes, and you know, all of us, when we spend a decent amount of money on a new pair of shoes, we're really annoyed if they're just not the right shoe, and it's hard to throw them away. So I bought these shoes. Brand was OrthoFit, supposedly specifically for nurses because we're on our feet all the time, right? And they're stretchy, and they have elastic shoelaces, which actually for me are important because by the 40th time I have to retie my shoes on a shift, I tend to tie them too tight, and I've actually damaged the nerves in my feet doing that. So I they were one of my pair of shoes I wore to Italy. And my husband and I are just walking on your normal, uneven, death-defying cobblestone street. And somehow my shoe came flying off my foot. And I honestly wish someone had had a camera on me because I must have looked like a cartoon character, windmilling, trying to keep myself from falling. I failed, all right? Hit the ground, tore my knee up, and my shoe was in the street. I still don't know how that happened. The shoes are gone. They were the wrong shoe. Makes me mad. They were new shoes, but they're gone. Okay, yes.
Not going barefoot, is that bad?
Yes, and we're going to get to that. Okay? When you wear, I look around the room and I see a few socks. I see a lot of no socks. Want calluses? Want foot fungus? Want trauma to your toenails? Don't wear socks. Okay, so finally, we're going to get to the age-old question. Right? How often do you brush your teeth? Okay, so I would like a show of hands for the number of people in here who brush their teeth at least once a day. At least once a day. Okay? I mean, it's not like any of you are not going to raise your hands because your neighbor's going to move away from you. Right? Okay. So I actually did a poll as I was putting this program together, and I asked 50 people, how often do you brush your teeth? Why? Common answers I got. I like the way they feel afterwards. I don't want bad breath. I don't want cavities. I hate going to the dentist. I hate paying the dentist. But this is my favorite response because I want to keep them. Okay? All right. So babies are born. We were all born with these cute, cute little feet that just want to bite them. They're just so stinking cute, right? And they don't even look like they should hold that chubby little body up, right? And yet somehow they do, and they're amazing and wonderful and perfect and weird. I mean, those are just weird things, right? And when we're that little and we can get our feet to our mouth and suck on them, toes are the most wonderful things in the world, right? And that's the last time we think about them. Until today when I asked you to think about your feet. Okay? Fungus. Okay? Once in a very, very, very blue moon, I have someone sit in my chair who does not have toenail fungus. Once in a blue moon. I had one today. I'm always so excited when I have one that doesn't have toenail fungus. So I call it a TOP problem. Time on planet. Yes, spend enough time on the planet, you're probably going to end up with toenail fungus. Okay? All right. So can you cure toenail fungus? Okay, let me just make this really easy for you. On 3, I want everyone as loud as you can to say no. 1, 2, 3. No. Yeah. Okay, if there were a cure for toenail fungus, my husband would not have toenail fungus. Okay? You can spend a fortune on oils and creams and crap, and you will still have toenail fungus. There is a pill that I have never known a doctor to be willing to prescribe, which 50% of the time might cure it. But I always tell patients it's easier to live with toenail fungus than without your liver that the pill is likely to severely damage. Okay? Toenail fungus is rarely a real problem in that it causes problems, except look at these thickened toenails. That is a fall risk. That right there is on the top 10 for fall risks, okay? Because it's pressing up against the top of your shoe. It's forcing you to walk differently, balance differently, hold your feet differently. It is likely keeping your shoes and socks on all the time because you're embarrassed. And what do fungus like to grow in? Moist, dark environments, right? And inside your shoes and socks all the time is a lovely environment to encourage this growth, okay? Now, removing this growth, I do this more than anything else all day long in that room over there, is removing this growth. It's actually incredibly satisfying. And it's your toes, if your toes look like that or worse, I promise you, they will look awful when you leave, but over time, I can get them looking a heck of a lot better. But you gotta be consistent with the treatment. What's the treatment? Removing it down, removing it down, removing it down. Because see what happens is as the toenail gets thicker, underneath here, there is tissue that is growing for the sky, okay? And it's disattaching the toenail from the nail bed, all right? Which allows debris to get in between the nail and the nail bed. And guess what debris is? Food for the fungus, right? So we need to get rid of all of that. We need to keep cutting it back, cutting it back, cutting it back until we get it to the point where all that's left is nail attached to nail bed. And slowly over time, we can encourage the growth of that nail to come back and reattach to the nail bed. Is it ever going to be perfect? Are we going to get rid of the fungus? 1, 2, 3? No. But we can control it.
Does nail polish create a problem with fungus?
Okay, I have no problem with patients using nail polish, but I ask one thing. Only use OPI nail polish, okay? Because it doesn't have formaldehyde or heavy metals, okay? Other nail polishes do. Can't say they all do, but I know OPI doesn't, okay? Don't leave toenail polish on for 4 months. A week or two, take it off, give your toes a little break, do it again, okay? All right. So, there actually is some scientific evidence that says if you soak your toes in apple cider vinegar for 10 to 15 minutes a day, every single day, for a year, okay, there is a 50% chance of curing fungus, which is the same as the pill that kills your liver, but the apple cider vinegar doesn't kill your liver, okay? And I've had a lot of patients decide to do this. I have never had anyone make it a year. But maybe you'll be the first. Could be, right? Okay. Now, lest you think that this is a rarity, at least once every month or two, I have that in my chair and worse. Okay? And this and this. I see that every other patient, okay? This I've had to where they're growing in spirals, okay? And when someone comes and sits in my chair and the first words out of their mouth are, "I'm so embarrassed to let you see my feet," my heart breaks, because it means they've been living with something awful for a really long time and didn't get help for it before. But at least you're here now, and we're going to make this better. Okay, so I just want to point out a few issues here. On these, okay, we have a fungal problem, okay? We have an overgrowth problem. We undoubtedly have a thickness problem, okay, the thickened nails. But we also have these huge calluses on the ends of the toes and on the bunion, all right? I mean, that's just got to hurt so darn much, I can't even think about it. Oh, and something I didn't mention about fungus. Is there something, a common healthcare condition that you think might make fungal infections worse? Can you think of one? Diabetes. Yeah, the high sugar. Okay? Yeah. So we have those issues going on in this foot. But you know what? I can send this person out with that foot looking 1,000% better in one session. Okay? So come. I can fix it. Again, terribly satisfying. You call the front desk. Yeah. Okay, here we have a fungal infection. Now here's what I'm going to do with this nail. This nail, I am going to grind the heck out of it, and there's going to be almost no nail left when I'm done. Okay? But what we're going to be back to is the healthiest nail you've got. And then we're going to slowly but surely bring it forward. And it's always going to be 2 steps forward, 1 step back until we get something reasonable. Okay? This one you can see there's a little bit of a, I hope you can see, like a space between the nail and the nail bed. And that is just a food factory for fungus. And so we want to get rid of that. We don't want debris to be able to catch underneath it. We want to get rid of it. Okay? Now here we have, that's just the tiniest bit of fungus, but let's catch it now and see what we can do. But what I want you to see is this nail. It's white. It doesn't have the white here and the pink. And my guess is this is bad nail polish that they kept on for 6 months. They just let it chip away. Okay? But this is a pretty easy fix. Okay? This one, the big problem, I mean, we have fungus and all of that going on, but look at this. Look at the cuticle. That cuticle is hard and dry, which means it can't do anything but keeping bad stuff out or good stuff in, which is the job of the cuticle. So I have to grind all of that away to get to new cuticle, which you then need to massage with cream on a regular basis to make it better. Okay? And that, believe it or not, is just your average foot fungus and easily fixable. This one, again, we have terrible cuticles, all right? The nails are the least of the problem here. It's trying to get this guy, because I know this is a guy. Do you know how I know it's a guy? He has never in his life willingly put lotion on his body, okay? I don't know what it is with you guys and lotion. It's a good thing, okay? Okay. So, how do I take care of my toenails? I can't reach them, I can't see well, I have diabetes, okay? Here's how you do it. You go and let someone else do it, okay? I go and get my toenails done. I go to a salon, all right? And they are safe, they are clean, they are almost always run by Vietnamese, because that's the way the Vietnamese community has managed to bring their community to the U.S. and make a good living. Yes?
How often do you think you should do that?
You know, it depends on your feet. If I don't go every 3 weeks, my ingrown toenails are going to put me through the roof, and I'm grumpy, and nobody wants a grumpy nurse. So one of the things that a lot of women, this is a secret, okay, can't leave the room. A lot of women will tell me, you know what, I'm uncomfortable because they're always speaking another language and I just know they're talking about me. Okay? So one time I talked, well, more than one time, but once I talked my husband into coming with me so I didn't have to do his nails and we could both get our nails done. He was not a fan. He sat there, and after we walked out, my husband was in Vietnam. I said, so what are they talking about all the time? And he looks at me and he says, the same crap you talk about. What your husband screwed up, what your kids screwed up, what a mess the house is, what you're making for dinner. They're not talking about you. You're not that interesting. Okay, daily, weekly care. Clean and moisturize your feet. Have your feet tended to just like you go to the dentist, all right? So, here is a big problem I see in a lot of feet that is so easily fixable. When you get out of the shower, now you don't have those big spaces between your feet, right? But works for our purposes. Take a Kleenex, take a paper towel, not a bath towel, okay? You want something disposable. And the folded portion, I want you to put between your toes, and guess what? You're going to floss your toes. You're probably lousy at flossing your teeth, but maybe you'll be better about flossing your toes. And get the moisture out, because what does fungus like? Moist, dark places, okay? Not only that, moisture causes skin damage with skin breakdown between the toes. Do not ever moisturize between your toes. Ever, ever, ever. Do not put wet between your toes. Keep between your toes nice and dry. Okay? Inspect them for damage. Well, I can't reach them to cut my nails. How am I going to inspect for damage? Well, if you live with another human being, make them put their glasses on and look at your feet, and you do the same for them. And if you don't live with someone, put a mirror on the ground and hold your foot over it and look, okay? If you have diabetes, what color socks should you wear?
White.
White. Why?
To see any drainage.
To see any damage. Yeah, if there's ooze coming out, if there's blood, because if you have diabetes, your feet are to some degree numb. The high blood sugars over the years have damaged the nerves, all right? But here's the thing, it's not just diabetic feet. High blood pressure or cardiac issues. White socks. Take them off every day, Look at the sock. You'll know if there's been damage during the day. And then go get it taken care of. All right? Okay, so notice changes in your feet, and don't put up with a care provider who does not take your feet or you seriously. No, just don't. Get a different care provider, okay? If they don't take you seriously, move on down the road till you find someone who does, okay? Because doctors who pay attention to your feet are paying attention to all of you, all right? When you sit in my chair, I can tell if you have circulatory problems, if you have out of control blood sugars, if you have hypertension, if you have cardiac heart failure. There are a lot of things I can tell just by looking at your feet. Yes?
What about telemedicine?
Telemedicine? Well, during COVID, I was forced to practice telemedicine, so that right there ought to tell you something. I can't see you, I can't touch you, I don't like it. Are there times it's appropriate? Yeah, I've got this pain in my shoulder and I've had it for this long and all of that. Okay, can you put your arm up? Can you do this? All right, let's send you for the x-ray. That's okay, right? But other things like looking at your feet. I can't look at your foot over your telephone appropriately. I can't touch it, feel what's tender, what's not tender, all of that. So you've got to see what things it makes sense for and what things it doesn't. But if it's just talking, I'm not a fan. I want to see and touch my patients. I'm old-fashioned, I know. But we want happy feet, okay? So don't ignore problems. Okay, so what is good foot care? Well, the basics. Your skin condition and nail condition. We want your skin not to be dry, not to be scaly. If you've got big patches of dry on your skin, think of it most of the time like a snake that can't shed its skin, and the skin kind of gets attached to the snake's body and can do a lot of damage, right? And the easiest way to deal with that is a nail brush completely filled up with cheapy hand lotion. And you just gently brush at it. Don't try and do it all at once because your feet will be really sore. But over a few days, you can get rid of all of that scaliness and new skin can grow, okay?
What about pumice stone?
No, because we don't want to scratch your good, healthy skin. We just want to get rid of the stuff that won't disattach. And we want this to be getting under it to pull it up. I'm not a big fan of pumice stones. I've seen people do some real damage to themselves with pumice stones. Or those egg-looking things that look like a cheese grater, okay? Use them to grate cheese. That's what they're for. Okay, shoes, they need to be properly fitted. How many of you are wearing the same size shoe now you wore 10 years ago? Let's see a show of hands. You're in the wrong size shoe. Okay, your feet don't continue to grow, but our ligaments stretch out and flatten. Okay, we all have flat feet by now. Okay, maybe one time we had high arches. We don't have high arches anymore. They left. All right, and so as that happens, we need more room. Our toes spread out. We all need a wide toe box, all right? That means kind of a squared off box, not stilettos, right? Okay. Socks, quality socks, relatively thick socks, not, thin nylon socks, okay? Again, you have diabetes, high blood pressure, cardiac issues, circulatory problems. What color are the socks? White. And activity. Okay? Best activity that you can do is walking and swimming. Okay? You say, well, it hurts to walk. You know what? I want you to walk to your mailbox and back. That's it. Just walk to your mailbox and back. And do that every day, maybe a couple times a day. And you know what? In a week or two, you'll be able to make it to your neighbor's mailbox and back. And then the one beyond that. And if you do it every day, no lie, it won't take long before you can walk a mile. in well-fitting shoes with good socks, knowing that you have good balance, which is where the sail classes come in. Again, I can't recommend them highly enough. I honestly feel everyone in this room benefits from those classes. Okay.
We have these, you want to show this?
Oh, okay. So chair stand sale is on Zoom Tuesdays and Thursdays, 11 to 12. And what about the?
There's one here also,
Oh, and there's one here. Okay.
in the afternoon of it.
In the afternoons. Okay.
Tuesdays and Thursdays.
All right. So come see this lovely lady and take a picture of the flyer. Okay. So let's talk skin. What's the best lotion to use on your skin? What's the best lotion? Anybody know? Okay. Okay, there is no lotion that is good to use on your skin. Okay? Okay, so lotions we put on our hands so they look better and maybe they smell good and they feel good for a few minutes, right? And you know how we're constantly reaching, the men don't know, but the women know. We're constantly reaching to put on more, right? Because it only lasts about 20 minutes or until we wash it off, okay? So we want to be using emollients and humectants, all right? An emollient penetrates the top 3 layers of living skin. You know what lotions penetrate? They might make it through the dead skin, maybe. Okay? So they actually aren't doing anything for you. So we want to use emollients, and the effects of an emollient last for up to 8 hours. We want to use humectants. They pull water deeper into the skin, several layers into living tissue. They improve the function of the skin, last up to 18 hours, and work with existing moisture. And you use them with an emollient because the emollient then seals the moisture in. When's the best time to put this on? Immediately after a shower. Immediately after you floss your feet after you get out of the shower. Okay, shoes. You need to be fitted by a specialist, okay? You need a gait evaluation, and it's free. Okay, now I am not allowed to say this, but I'm not very good about rules. Okay? Fleet Feet on 3rd Street in Santa Rosa, ask for Rhonda. Gait evaluation is free. They have a machine you stand on for free that measures where the pressure is as you're balancing. Okay? And she will help you get into the right shoe and insole, and yes, you need both. Okay?
This might not pertain to anything, but I see shoes, like I'll go someplace and there'll be shoes, all this shelves right there, and the kids. How they look, that's not how it's good for them. How they look for class and style for America, they buy. Are they gonna have problems when they get older too?
Very likely. Yeah. So my youngest, when he was 13, he was coming down the stairs one day, and I realized that child is pigeon-toed. When the heck did that happen, right? Well, that's stupid. So I trotted him up to Rhonda, and she put him on the track, put him in a shoe and an insole, and had him walk on the track, and guess what? He wasn't pigeon-toed anymore. Okay, so in closing, some of you might know this lady. This is my wonderful friend, Etta Marie Peterson. She's amazing. She's my mentor, my hero, and inspiration. I think she's 85 this year, but I'm not going to ask. She moves constantly. Constantly. I have never seen this woman not in motion. I don't know that I've ever seen her sit, and that except in her car. That's no lie. She's a beekeeper. She's a retired special ed teacher with a PhD in education. She taught my son many years ago and continues to be a strong influence in his life. She's a 4-H leader, sharing her passion for farm life and bees with kids all over Sonoma County. She writes scientific articles for beekeeping magazines around the world. They hire her to come to other countries to talk about beekeeping. She travels extensively every chance she gets, often flying with her 87-year-old husband piloting the plane. Yeah, these people are amazing. They really are amazing. And I believe Etta Marie's objective in life is to go down looking like she got rode hard, put away wet. Okay? She moves all the time and she's active in body and mind. She is always intrigued with the next thing, all right? She never looks backwards. She can't do anything about it. She is an absolute force of nature. Her mother lived to 105, I think it was. I suspect Etta Marie may pass her up. We need to remain engaged, okay? We need to remain physically active. If you fall, you suffer the risk of breaking a wrist, an arm, a hip, a leg, being laid up for weeks. As you get older, it's much harder to recover. It takes so much longer, okay? And nobody wants to give you the good pain pills anymore, okay? So we don't want to get there in the first place, all right? So you need to have the best shoes for you. People, I got asked today, what are the best shoes to wear? I don't know. They're different for everyone. And every pair of shoes needs the right insert in the shoe because then it becomes custom to your foot, all right? The point is not, like this gentleman pointed out, how you look, but it's how they support your body. You know, supposedly at NASA, they have a poster that shows a bumblebee and says the bumblebee can't fly. It is not aerodynamically designed to be able to fly. The weight in the back is too great. But nobody told the bumblebee. Right? Okay. So you need to be aerodynamically engineered correctly. And that means being in shoes that will support your feet. It means getting rid of flip-flops. Okay? And any sandal that doesn't have a strap around the back. It means getting rid of rubber or plastic shoes. Okay? Rubber and plastic shoes. They encourage foot fungus and skin fungus. All right? They encourage your feet to sweat, which keeps them wet, which makes them slippery on a rubber or plastic surface, which encourages you to do what? Fall. Okay? I want everyone to stand up. And if you need to put your hand on the chair in front of you to do this, do it. I want you to put your feet pretty close together. Okay? And I am going to watch the clock when I say go. And I just want you to stand there and see how much you have to adjust. Feet close together, as close as you can. And now. Feel your body. How much adjusting is your body doing? How much are you rebalancing without even moving your feet? You're constantly having to rebalance your core. Your knees are moving. Okay, stop. That was only 15 seconds. Were you aware of how much your body was moving? Pretty amazing, right? Okay, sit back down. Okay, so that's what I got. And I've been told that I can answer a few questions, so if anything didn't get answered, yes?
I didn't have neuropathy until I got cancer. And the chemotherapy caused neuropathy. Is there anything you can do to make it better?
Well,
I tried gabapentin and I just...
Yeah, gabapentin is just, really for the pain. And so the short answer is probably not, okay? Occasionally it will correct, and it can be 20 years down the road. But most of the time, once you have it, you got it. Yeah.
Does nutrition play a role?
Nutrition plays a role in absolutely everything. So yes, yes, yes. All things in moderation, a balanced diet. Even if you're diabetic, you can have dessert sometimes. You just can't have it for breakfast, lunch, and dinner, right? Okay. You can have salt. By the way, there's no such thing as a sodium-free diet. Sodium-free diet will kill you, okay? Here's a low-salt diet. Don't put salt on your food after it's cooked. That's all you need to do. I saw a hand over here. Yes.
Look not barefoot.
No. Okay? Here's why. Okay, you don't balance as well on bare feet. You're opening yourself up to stepping on things, to stubbing your toe, Okay? Why more people don't break bones jumping around holding their foot after they hit their toe on the corner of the bed, I don't know. When you stub your toe, here's my problem with it. Very often you crack the toenail, you don't notice it at the time, and and it shoves the toenail up into the cuticle, which breaks the cuticle seal, and stuff gets up there, and you end up with toenail fungus. Barefoot is not a good thing. Okay?
If you're a diabetic,
No, because if you wear socks around the house, you slide. Shoes and socks. Shoes and socks. Shoes and socks. In the house, shoes and socks. Or really good deer foam makes a good slipper that is a fully enclosed slipper, and it has a rubber bottom. And those are really good. I recommend them all the time. Okay, all right. Anybody else has questions, you're welcome to come up and talk to me. Thank you all very much.
Where do you hear?